Hi, my name is Raven Trosclair, and the title of my speech is called Over-the-Counter Birth Control. My central idea is over-the-counter birth control helps women in many ways. It can lead to a decrease in teen and unintended pregnancies, giving access to underserved and low-income communities. Think about all the females who aren't able to afford a doctor's bill and just want to be safe in their sexual life, but can't. Nowadays, you hear about so many females bringing children to this world without a stable environment, proper care, or even love. This mainly results from a higher percentage of teen and unintended pregnancies. Over-the-counter birth control means being able to purchase any effective birth control method without having to visit a doctor and being that you're able to have in your life. Mainly birth control, if whoever don't know, birth control is mainly to prevent pregnancies. When I was about 16, I had this friend who was sexually active and wanted to get on birth control, but she was too afraid to tell her parents, so she had to sneak around to get her aunt to take her to the doctor for birth control to get a prescription. In favor of over-the-counter birth control, there will be plenty more little girls who can be able to go and buy the birth control for themselves, and they won't actually have to have a prescription. There are many positive reasons why there should be over-the-counter or birth control. It will increase access for low-income and medically underserved women, lower teen pregnancy rates, and ease access to health-improving drugs with many years of correctly safe use. And before we get started, I just want to show y'all this. This is a form of birth control. This is the patch. There's like a lot. It's like maybe, I would say about like 5-6 different methods of birth control, but this right here is one example. It's the patch. Okay. First, let's talk about how it affects teen pregnancies. Strongly over-the-counter birth control has a connection to teen pregnancies and can lower their rates tremendously. From 2007 to 2013, the nationwide teen pregnancy rate dropped 36% among 15 to 19-year-olds because of improved contraceptive use. Within those 6 years, there's a great change that happened, and it can continue to happen from here on out with even more improved contraceptive use and proper education from peers, parents, and more. We should all want to see that percentage decrease in teen pregnancies. Note that there are many over-the-counter drugs that are addictive and people can overdose on. But there are birth control pills that are impossible to overdose on. It is obvious to say how safe it is to take these pills because it contains estrogen and progestin, which only prevents ovulation in pregnancies and can't do any other harm to the body. Now, low-income and medically underserved women deserve the right to have an easy access to birth control. In low-income and underserved populations, it is difficult for those women to obtain birth control. It is difficult for them to pay for a doctor and the birth control too. So it's like more money coming out their pockets that they don't actually have. So, research found that if women were able to obtain oral contraceptives without a prescription as a covered health insurance benefit, there would be 11 to 21% increase in the number of women using the pill. Making oral contraceptives available without needing a doctor and a prescription would be a significant difference in how many women will be using birth control and reducing the gaps in women who already use it. Data also indicate that women obtaining over-the-counter oral contraceptives are significantly more likely continue to use than women obtaining prescriptions at clinics. This is proven through research and shows how there are a lot of women who can't afford to go to clinics. If there wasn't any over-the-counter birth control, it would require women 17 or younger to obtain a prescription, which may be impossible to do with their limited, restricted circumstances. These ways have an effect on us women, way more than we actually realize. Almost half of the pregnancies in the U.S. are accidental or unintended because of inconsistent use or non-use birth control being the leading causes. We need over-the-counter birth control. We do not need our teenage community with multiple babies or even any woman bringing a child into an unstable environment because they are not able to, they don't have that access to birth control. I want this to sink in for a minute. If you had a little sister or struggling family member, how would you feel if they did not have the proper tools to prevent something? In other words, how would you feel if they had an unintended pregnancy and can't afford it when it could have been prevented with one solution? Having easy access to over-the-counter birth control. Thank you.